Hello, and welcome back to our channel. In this video, we will be explaining the different types of hamstring injuries commonly seen in sports and active individuals. Before we get into today's video, be sure to hit that subscribe button down below. We post daily videos and aim to educate our audience on the world of sports medicine and to provide guidance on getting all athletes back to top-tier performance. First, let's explain a little more in depth about what happens with different types of hamstring injuries. The hamstring muscles, located at the back of the thigh, are made up of three muscles: the semitendinosus, semimembranosus, and biceps femoris. These muscles work together to perform knee flexion, which is the movement of bringing your heel towards your buttocks, and hip extension, which is the movement of straightening your leg behind you. Any sport that involves sudden bursts of speed, such as track, football, soccer, and baseball, or activities such as jumping and kicking, put a lot of stress on the hamstring muscles and can lead to injury. Hamstring strains are the most common type of hamstring injuries in sports. It occurs when the muscle fibers are stretched or torn. Strains can range in severity from a mild muscle pull to a complete tear of the muscle fibers. Strains can be classified into three grades, depending on the severity of the injury. Grade 1 strains are considered mild, with some discomfort and a little muscle spasms. It usually doesn't cause a lot of pain and the person can still walk. Grade A strains usually will start to heal within a couple of days to a week. Grade 2 strains are considered moderate, with moderate pain, swelling and muscle spasms, and it may affect the ability to walk. The recovery time for these strains are usually 1 to 2 weeks before the muscle is back to normal performance. Grade 3 strains are considered severe, with severe pain, swelling and muscle spasms, and it will cause the person to be unable to walk. The recovery time for grade 3 strains may take an extended amount of time of around a month to fully heal depending on severity. Symptoms of a strain include pain, swelling, and muscle spasms. The pain may be localized in one specific area or may be felt throughout the entire muscle. Hamstring tears occur when the muscle fibers are completely ruptured. A tear can be a partial tear, where only a few muscle fibers are affected, or a complete tear, where all the muscle fibers are affected. Tears are considered more severe than strains, and they are more difficult to treat. Symptoms of a tear include severe pain, swelling, and difficulty walking. The person may also feel a pop or snap at the time of the injury. Recovery time for tears can range from 1 to even 3 months if it is a complete tear. Hamstring contusions are bruises that occur when the muscle is hit or struck. Contusions can be caused by a direct blow to the muscle or by a fall. Symptoms of a contusion include pain, swelling, and muscle stiffness. The pain may be localized in one specific area or may be felt throughout the entire muscle. Contusions are usually caused by a direct blow to the muscle, such as a fall or a hit from a ball. In general, it is important to seek medical attention if you suspect you have a hamstring injury, so a proper diagnosis can be made and an appropriate treatment plan can be developed. Treatment for a hamstring injury will depend on the severity of the injury. Physical therapy will often be a part of the treatment plan to help improve flexibility and strength. For mild strains or contusions, rest, ice, and over-the-counter pain medication may be sufficient. A physical therapist may also recommend exercises to improve flexibility and strength. More severe injuries may require physical therapy, and in some cases, surgery may be necessary. It is important to follow the treatment plan as directed by your doctor or physical therapist to ensure a full recovery. Prevention is key when it comes to hamstring injuries. Stretching before and after exercise, gradually increasing the intensity of your workout, and using proper form during exercises can all help to prevent injury. Wearing proper shoes and making sure to warm up properly before doing any physical activity can also help to prevent injury. In summary, hamstring injuries are common among athletes and active individuals, and can range in severity. It is important to know the symptoms of a hamstring injury and to seek medical attention if you suspect you have one. Following the recommended treatment plan and taking preventative measures can help to ensure a full recovery and return to the field in no time. Thanks for watching. If you enjoyed this video, click the video on the screen to learn even more on the world of sports medicine. We'll see you next time.